Certified Medical Assistant Exam Full Review. Question 1. Hemoglobin A1C test result of 7.2% in a diabetic patient indicates which of the following? Option A, excellent blood glucose control. Option B, blood glucose has been moderately elevated over the past 2 to 3 months. Option C, the patient is in diabetic ketoacidosis. Option D, normal glycemic control. The correct answer is option B. Blood glucose has been moderately elevated over the past 2 to 3 months. Blood glucose has been moderately elevated over the past 2 to 3 months is the best answer because it directly addresses the clinical or administrative concept in the question. The STEM contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 2. If a patient is diagnosed with hepatomegaly, they have an enlargement of what organ? Option A, spleen. Option B, liver. Option C, kidney. Option D, heart. The correct answer is option B. Liver. Liver is the best answer because it directly addresses the clinical or administrative concept in the question. The STEM contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 3. Physician orders amoxicillin 500 mg. The available supply is amoxicillin 250 mg/capsule. How many capsules should be administered? Option A, 1 capsule. Option B, 2 capsules. Option C, 3 capsules. Option D, 0.5 capsule. The correct answer is option B. 2 capsules. 2 capsules is the safest and most accurate medication-related response. Medication administration depends on the correct patient, drug, dose, route, timing, site, and monitoring concern. The other choices are inappropriate routes, classifications, calculations, or safety actions for the order described. Question 4. Which of the following actions should be taken after venipuncture to prevent hematoma formation? Option A, apply firm pressure with gauze for 3 to 5 minutes. Option B, apply warm compress immediately. Option C, flex the patient's arm at the elbow. Option D, massage the puncture site vigorously. The correct answer is option A. Apply firm pressure with gauze for 3 to 5 minutes. Apply firm pressure with gauze for 3 to 5 minutes follows standard specimen collection and laboratory practice. Correct site selection, tube order, additives, and specimen handling help prevent contamination, hemolysis, and inaccurate results. The other options would either compromise the specimen or apply to a different test. Question 5. Which of the following implies that a patient has been informed of the risks, benefits, and alternatives of a procedure before agreeing to it? Option A, implied consent. Option B, informed consent. Option C, expressed consent. Option D, advance directive. The correct answer is option B. Informed consent. Informed consent is the best answer because it directly addresses the clinical or administrative concept in the question. The STEM contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 6. Which of the following is an example of a fomite? Option A, mosquito carrying malaria. Option B, stethoscope contaminated with MRSA. Option C, airborne droplet nuclei from a cough. Option D, contaminated drinking water. The correct answer is option B. Stethoscope contaminated with MRSA. Stethoscope contaminated with MRS follows standard infection control practice. Medical assistants reduce transmission by using proper hygiene, PPE, disposal, isolation, and sterilization procedures. The other choices are incomplete, apply to different precautions, or would not adequately control microorganisms. Question 7. Which of the following is a contraindication to spirometry testing? Option A, chronic obstructive pulmonary disease. Option B, asthma. Option C, recent upper respiratory infection. Option D, recent myocardial infarction or surgery within the past month. The correct answer is option D, recent myocardial infarction or surgery within the past month. Recent myocardial infarction or surgery within the past month is the correct clinical procedure principle for this scenario. Positioning, aseptic technique, patient preparation, and equipment use must match the procedure being performed. The other options are incorrect for the procedure or could reduce safety and accuracy. Question 8. Physician asks you to administer a PPD test for tuberculosis. Which injection route will you use? Option A, intramuscular. Option B, subcutaneous. Option C, intradermal. Option D, intravenous. The correct answer is option C, intradermal. Intradermal is the safest and most accurate medication-related response. Medication administration depends on the correct patient, drug, dose, route, timing, site, and monitoring concern. The other choices are inappropriate routes, classifications, calculations, or safety actions for the order described. Question 9. Artifact on an ECG tracing most commonly results from which of the following? Option A, incorrect lead placement on the correct limb. Option B, patient movement or muscle tremors. Option C, overuse of conduction gel. Option D, calibration setting error. The correct answer is option B, patient movement or muscle tremors. Patient movement or muscle tremors is consistent with standard electrocardiography principles. Proper lead placement and waveform recognition are essential for producing an interpretable tracing. The other options describe different waves, leads, or artifact causes and do not match the stem. Question 10. Which bone is commonly called the kneecap? Option A, fibula. Option B, patella. Option C, tibia. Option D, tarsus. The correct answer is option B, patella. Patella is the best answer because it directly addresses the clinical or administrative concept in the question. The stem contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 11. The term neuropathy refers to a disease or dysfunction of which body system? Option A, cardiovascular system. Option B, endocrine system. Option C, nervous system. Option D, musculoskeletal system. The correct answer is option C, nervous system. Nervous system matches the medical terminology clue in the stem. Medical terms are built from roots, prefixes, suffixes, and accepted abbreviations, so identifying the keyword part leads to the correct meaning. The other choices describe different word parts, conditions, or procedures and do not match this definition. Question 12. An artifact on an EKG caused by patient movement or muscle tremors is called what? Option A, wandering baseline. Option B, AC interference. Option C, somatic tremor. Option D, interrupted baseline. The correct answer is option C, somatic tremor. Somatic tremor is consistent with standard electrocardiography principles. Proper lead placement and waveform recognition are essential for producing an interpretable tracing. The other options describe different waves, leads, or artifact causes and do not match the stem. Question 13. Which of the following best describes a health maintenance organization, HMO? Option A allows patients to see any provider without a referral. Option B requires patients to select a primary care physician who coordinates care and provides referrals to specialists. Option C pays providers based on fee-for-service with no network restrictions. Option D reimburses patients directly for medical expenses. The correct answer is option B. Requires patients to select a primary care physician who coordinates care and provides referrals to specialists. Requires patients to select a primary care physician who coordinates care and provides referrals to specialists is the best answer because it directly addresses the clinical or administrative concept in the question. The STEM contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 14. Patient who speaks limited English has arrived for an appointment. The most appropriate action to ensure effective communication is which of the following? Option A. Ask the patient's family member to interpret. Option B. Use a qualified medical interpreter or translation service. Option C. Speak slowly and loudly in English. Option D. Use gestures and pictures only. The correct answer is option B. Use a qualified medical interpreter or translation service. Use a qualified medical interpreter or translation service represents the best administrative or communication practice. Clear documentation, respectful communication, and proper scheduling protect patient safety and office workflow. The other options are less professional, less accurate, or could violate privacy or documentation standards. Question 15. Which of the following scheduling systems books multiple patients for the same appointment time and serves them in order of arrival? Option A. Stream scheduling. Option B. Wave scheduling. Option C. Open scheduling. Option D. Double booking. The correct answer is option B. Wave scheduling. Wave scheduling represents the best administrative or communication practice. Clear documentation, respectful communication, and proper scheduling protect patient safety and office workflow. The other options are less professional, less accurate, or could violate privacy or documentation standards. Question 16. For an adult, the ratio of chest compressions to rescue breaths during 2 rescue or CPR is which of the following? Option A 15:2. Option B 20:2. Option C 30:2. Option D 30:1. The correct answer is option C. 30:2. 30:2 is the priority response for the emergency described. Emergency care focuses first on airway, breathing, circulation, rapid recognition, and prompt activation of the appropriate protocol. The other choices delay care or apply to a different emergency. Question 17. Which of the following is an example of a CLIA wave test? Option A. Complete blood count, CBC. Option B. Urine pregnancy test. Option C. Comprehensive metabolic panel, CMP. Option D. Tissue biopsy analysis. The correct answer is option B. Urine pregnancy test. Urine pregnancy test is the best answer because it directly addresses the clinical or administrative concept in the question. The STEM contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 18. When a patient refuses a treatment or procedure, the medical assistant should do what first? Option A. Administer the treatment anyway. Option B. Argue with the patient. Option C. Document the refusal in the patient's chart and notify the physician. Option D. Discharge the patient immediately. The correct answer is option C. Document the refusal in the patient's chart and notify the physician. Document the refusal in the patient's chart and notify the physician is the best answer because it directly addresses the clinical or administrative concept in the question. The STEM contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 19. Which of the following correctly defines CO insurance? Option A, fixed dollar amount paid by the patient at each visit. Option B, the percentage of costs the patient pays after meeting the deductible. Option C, the maximum out-of-pocket amount the patient pays per year. Option D, the annual amount the patient must pay before insurance benefits begin. The correct answer is option B, the percentage of costs the patient pays after meeting the deductible. The percentage of costs the patient pays after meeting the deductible is the correct administrative billing or coding concept. Accurate code use, claim handling, and payer communication support reimbursement and regulatory compliance. The other choices describe different payment terms, programs, or coding systems. Question 20. The sinoatrial SA node is located in which chamber of the heart? Option A, left ventricle. Option B, left atrium. Option C, right atrium. Option D, right ventricle. The correct answer is option C, right atrium. Right atrium is the correct clinical procedure principle for this scenario. Positioning, aseptic technique, patient preparation, and equipment use must match the procedure being performed. The other options are incorrect for the procedure or could reduce safety and accuracy. Question 21. When administering an intradermal injection for a tuberculin skin test, the needle should be inserted at which angle? Option A, 45 degrees. Option B, 30 degrees. Option C, 25 degrees. Option D, 10 to 15 degrees. The correct answer is option D, 10 to 15 degrees. 10 to 15 degrees is the safest and most accurate medication-related response. Medication administration depends on the correct patient, drug, dose, route, timing, site, and monitoring concern. The other choices are inappropriate routes, classifications, calculations, or safety actions for the order described. Question 22. Which of the following is an example of a closed-ended question during a patient interview? Option A, are you allergic to penicillin? Option B, tell me about your chest pain. Option C, how has your pain changed since your last visit? Option D, what brings you in today? The correct answer is option A. Are you allergic to penicillin? Are you allergic to penicillin is the best answer because it directly addresses the clinical or administrative concept in the question. The stem contains the key detail needed to separate the correct response from similar distractors. The other options refer to different findings, procedures, body structures, or office processes and do not fit this item. Question 23. Patient is scheduled for a colonoscopy. The medical assistant's role in patient education should include which of the following? Option A, explaining the procedure in detail as if performing it themselves. Option B, reinforcing the physician's pre-procedure bowel preparation instructions. Option C, advising the patient on post-procedure dietary changes without physician direction. Option D, deciding which sedation the patient will receive. The correct answer is option B, reinforcing the physician's pre-procedure bowel preparation instructions. Reinforcing the physician's pre-procedure bowel preparation instructions is the safest and most accurate medication-related response. Medication administration depends on the correct patient, drug, dose, route, timing, site, and monitoring concern. The other choices are inappropriate routes, classifications, calculations, or safety actions for the order described.
Question 24. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A, miscalibrating a chemistry analyzer machine. Option B, misidentifying a patient before collecting their sample. Option C, misinterpreting a reading on a microscopic smear sheet. Option D, delays in transmitting finalized electronic reports to the doctor. The correct answer is option B, misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 25. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A fasting glucose of 90 mg/dl. Option B, a potassium level of 2.1 mg/L. Option C, a total cholesterol level of 210 mg/dl. Option D, a white blood cell count of 7,500/mcl. The correct answer is option B, a potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 26. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 27. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A, the sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B, the blood flow will stop completely due to arterial vasoconstriction. Option C, the platelet count will become falsely elevated beyond high limits. Option D, the glucose values will drop to zero within seconds. The correct answer is option A, the sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 28. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A, layered drop upon drop until the circle is saturated. Option B, applied to both sides of the paper simultaneously. Option C, brought into direct contact with a single large drop to fill the circle completely. Option D, smeared across the surface using a plastic capillary tube. The correct answer is option C, brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 29. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B, it can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 30. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D.
The correct answer is option C. Vitamin D.
Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 31. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 32. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A, activated partial thromboplastin time, APTT. Option B, bleeding time test. Option C, prothrombin time / international normalized ratio, patient / INR. Option D, complete blood count, CBC. The correct answer is option C, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 33. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 34. Why is a royal blue top tube used for trace element and toxicology testing? Option A, the tube contains a unique fast-acting liquid anticoagulant. Option B, the tube stoppers are specially manufactured to be free of trace element contamination. Option C, the tube is thicker to resist breaking in specialized centrifuges. Option D, the tube completely blocks out all infrared and UV rays. The correct answer is option B, the tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 35. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 36. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, statutory consent.
The correct answer is option C. Cardiac muscle.
Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 37. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes.
The correct answer is option C. Gentamicin.
Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 38. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, grey top. Option D, green top.
The correct answer is option C, bounced check.
Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 39. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot.
The correct answer is option A. Erythrocyte sedimentation rate, ESR.
Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 40. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A, dropping a needle into the sharps box immediately after withdrawal. Option B, pushing down on items inside a full sharps container to make extra room. Option C, disposing of a sharps box when it reaches the indicated full fill line. Option D, placing the sharps container at eye level near the point of use. The correct answer is option B, pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 41. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 42. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A, erythrocyte sedimentation rate, ESR. Option B, oral glucose tolerance test, OGTT. Option C, activated partial thromboplastin time, APTT. Option D, blood urea nitrogen, BUN. The correct answer is option B, oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses grey tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 43. How many times should a light blue top tube be inverted immediately after collection? Option F, 1 to 2 times. Option B, 3 to 4 times. Option C, 5 to 8 times. Option D, 10 to 12 times.
The correct answer is option C. Runny nose.
Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 44. What is the proper location for a capillary puncture on an infant's foot? Option A, the center of the plantar surface near the arch. Option B, the medial or lateral borders of the plantar surface of the heel. Option C, the tip of the great toe. Option D, the posterior curvature of the heel bone. The correct answer is option B, the medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 45. A specimen for a lactic acid test must be handled using which special accommodation? Option A, placed immediately on an ice slurry. Option B, incubated at 37 degrees Celsius until tested. Option C, kept away from all light sources using foil. Option D, centrifuged immediately within 5 minutes of draw.
The correct answer is option A. Autoclave, steam sterilization.
Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 46. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 47. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, EDTA. Option C, sodium polyethylene sulfonate. Option D, thrombin.
The correct answer is option C. Remain as still and quiet as possible.
EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 48. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A, a 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 49. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm.
The correct answer is option C. At every clinical visit.
Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 50. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A, directly from the 4 line itself. Option B, from the left arm. Option C, above the 4 site on the right arm. Option D, from the hand on the right arm.
The correct answer is option D. All patients regardless of diagnosis or infection status.
Drawing from the opposite arm avoids dilution or contamination from the 4 infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 51. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas (ABG) draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 52. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein.
The correct answer is option B. Systolic pressure.
A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 53. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 54. If a phlebotomist needs to collect blood from an infant via venipuncture, what is the preferred needle choice? Option A, a 21-gauge standard multisample needle. Option B, an 18-gauge hypodermic needle. Option C, a 23-gauge or 25-gauge winged infusion set, butterfly. Option D, a large bore trocar needle. The correct answer is option C, a 23-gauge or 25-gauge winged infusion set, butterfly. Infant venipuncture requires a small, controlled device to reduce vessel trauma. A 23 or 25-gauge winged infusion set allows better stability and visualization in small veins. Large bore needles increase injury risk and are not appropriate for fragile pediatric veins. Question 55. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes.
The correct answer is option B. Blood in the urine.
Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 56. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 57. What is the definition of fomite in an infection control context? Option A, an insect that transmits a virus. Option B, an inanimate object capable of harboring and transmitting infectious agents. Option C, a chemical agent used to sanitize skin surfaces. Option D, a specific type of airborne droplet nucleus. The correct answer is option B, an inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bedrails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 58. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A, artery. Option B, capillary. Option C, vein. Option D, arteriole.
The correct answer is option C, appendectomy.
Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 59. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A, it is too small to yield an adequate sample. Option B, it is located near the brachial artery and median nerve. Option C, it has a high tendency to collapse under low pressure. Option D, it contains valves that prevent blood flow into the tube. The correct answer is option B, it is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 60. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 61. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, to activate the coagulation cascade prior to sample collection. Option D, to check if the vein has adequate pressure to fill a full tube. The correct answer is option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 62. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A, change the requisition manually using a pen to match the verbal statement. Option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C, draw the blood and sort out the labeling discrepancy later in the lab. Option D, assume the patient knows their own name and print a new label on the spot. The correct answer is option B, Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 63. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids.
The correct answer is option C. Medicare.
The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 64. Which of the following blood components is responsible for the initiation of the coagulation process? Option A. Erythrocytes. Option B. Leukocytes. Option C. Thrombocytes. Option D. Hemoglobin.
The correct answer is option B. CMS 1500.
Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 65. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A. Red. Option B. Green. Option C. Light blue. Option D. Lavender.
The correct answer is option C. Use plain language to re-explain and confirm understanding by asking the patient to repeat back the instructions.
CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 66. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 67. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A. Cyanosis. Option B. Jaundice, icterus. Option C. Erythema. Option D. Pallor.
The correct answer is option D. Sims. Left lateral position.
Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 68. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A. Basilic vein. Option B. Cephalic vein. Option C. Median cubital vein. Option D. Brachial vein.
The correct answer is option B. Carbohydrates.
The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 69. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A. Hypovolemic shock. Option B. Septic shock. Option C. Anaphylactic shock. Option D. Cardiogenic shock.
The correct answer is option B. Low sodium, Diet.
Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 70. Which of the following practices helps ensure compliance with standard precautions in phlebotomy? Option A. Wearing gloves during all vascular access procedures and changing them between patients. Option B. Reusing plastic tube holders as long as no blood is visible on the outside surface. Option C. Washing disposable nitrile gloves with soap and water to extend their use. Option D. Placing used lancets into regular trash cans if they look clean. The correct answer is option A. Wearing gloves during all vascular access procedures and changing them between patients. Standard precautions require gloves for vascular access and glove changes between patients. This treats all blood and body fluids as potentially infectious regardless of known diagnosis. Reusing holders, washing disposable gloves, or discarding sharps in regular trash violates safe practice. Question 71. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A. 70% ethyl alcohol. Option B. Povidone. Option C. Hydrogen peroxide. Option D. Benzalkonium chloride.
The correct answer is option B. Quarter pound or 0.1 kilogram.
Povidone is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose. Question 72. How should a phlebotomist approach a child who needs a blood test? Option A. Tell them it will not hurt at all to gain their trust. Option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C. Have 3 guards hold them down before introducing yourself. Option D. Show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 73. What is the correct protocol for mixing an additive tube after filling? Option A. Shake it vigorously up and down 5 times. Option B. Roll it back and forth between your palms for 30 seconds. Option C. Invert it gently back and forth the recommended number of times. Option D. Let it sit completely still in a rack to mix naturally. The correct answer is option C. Invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 74. When centrifuging specimens, what is the most important operational rule to follow? Option A. Centrifuging serum tubes immediately before they clot. Option B. Ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C. Leaving the lid open slightly to prevent overheating of the tubes. Option D. Setting the speed to the maximum RPM regardless of tube type. The correct answer is option B. Ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 75. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A. Plasma. Option B. Serum. Option C. Whole blood. Option D. Fibrinogen-rich extract.
The correct answer is option B. Medical, surgical, and diagnostic procedures.
Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 76. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent.
The correct answer is option D. Attach the electrode pads to the patient's bare chest.
Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 77. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1, Option B 5:1, Option C 9:1, Option D 10:1.
The correct answer is option A. Distance visual acuity.
Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 78. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A, 70% isopropyl alcohol prep pads. Option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C, tincture of iodine solution. Option D, concentrated hydrogen peroxide spray. The correct answer is option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 79. Which of the following statements is true regarding a multisample needle gauge? Option A 21-gauge needle has a larger opening than a 22-gauge needle. Option B, an 18-gauge needle is smaller than a 23-gauge needle. Option C, the larger the gauge number, the larger the needle lumen. Option D, all needles used in phlebotomy have the same internal diameter. The correct answer is option A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely, the higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 80. What is the function of the thixotropic gel inside an SST or PSD tube? Option A, to accelerate the coagulation cascade. Option B, to form a physical barrier between cells and serum/plasma during centrifugation. Option C, to preserve glucose levels for up to 24 hours. Option D, to chelate calcium and prevent fibrin formation. The correct answer is option B, to form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 81. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A, flammability hazard. Option B, reactivity hazard. Option C, health hazard. Option D, special or specific hazard.
The correct answer is option C. On the thumb side of the inner wrist.
The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 82. What is the function of sodium polyent whole sulfonate, SPS, inside a yellow top blood culture tube? Option A, to inhibit the growth of bacteria. Option B, to preserve glucose levels for bacterial metabolism. Option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. Option D, to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 83. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A, light green top, PSD. Option B, gold or red / black marbled top, SST. Option C, lavender top, EDTA. Option D, light blue top, sodium citrate. The correct answer is option B, gold or red / black marbled top, SST. Gold or red black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 84. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A, powdered latex. Option B, non-powdered latex. Option C, nitrile or vinyl. Option D, cotton utility gloves.
The correct answer is option B. High potential for abuse and severe dependence. A subpoena dutes tecum orders a person to appear and bring specified documents, such as medical records. Residential ipsa loquitur is a negligence doctrine, meaning the event speaks for itself. Quid pro quo refers to an exchange-based form of harassment, and a deposition involves sworn testimony rather than the specific command to bring records. Question 85. A medical assistant is preparing to perform a capillary puncture on an adult patient. Which of the following fingers should the assistant select? Option A, index finger. Option B, thumb. Option C, ring finger. Option D, pinky finger. The correct answer is option B. Nothing per os, nothing by mouth. For adult capillary puncture, the distal segment of the middle or ring finger is preferred because it provides adequate blood flow with less risk of bone injury. The thumb, index finger, and pinky are avoided because they are more calloused, more sensitive, or have less tissue depth. Index finger is more sensitive and frequently used, so it is avoided for capillary puncture. Thumb tissue is often thicker and more calloused, making it a poor puncture choice, and the pinky has less tissue depth and greater risk of bone injury. Question 86. A medical assistant is reviewing a patient's billing account and notices a credit balance. What does a credit balance indicate? Option A. The patient owes the practice money. Option B. The insurance company denied the claim. Option C. The practice owes the patient or insurance company a refund because of an overpayment. Option D. The balance is zero. The correct answer is option C. The practice owes the patient or insurance company a refund because of an overpayment. A credit balance means payments or adjustments exceed the amount owed, so the practice may need to refund the patient or payer. It does not mean the patient owes more or that the account is zero. A patient debit balance means the patient owes money, a credit balance means too much was paid, a denial means the payer refused payment for a claim, it does not automatically indicate an overpayment refund is due, and a zero balance means nothing is owed by either party, unlike a credit balance. Question 87. Which of the following terms refers to the specific amount of money a patient must pay to keep their health insurance policy active? Option A, deductible. Option B, premium. Option C, CO insurance. Option D, allowed charge.
The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw.
A premium is the amount paid to keep insurance coverage active. Deductibles, co-payments, and co-insurance are paid when services are used. A deductible is the amount the patient must pay before insurance begins paying for covered services. This insurance term describes a different part of patient financial responsibility or payer reimbursement than the one being asked about. An allowed charge is a different medical term, so its meaning does not fit the definition given in the STEM. Question 88. Which of the following organ systems is responsible for filtering waste products from the blood and maintaining fluid balance? Option A, digestive system. Option B, endocrine system. Option C, urinary system. Option D, lymphatic system.
The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help.
The urinary system filters blood, removes wastes, regulates fluid balance, and helps maintain electrolyte and acid-base balance. Digestive and endocrine systems have different primary roles. That body system performs a different primary function than the one described in the STEM, and the endocrine system produces hormones that regulate metabolism, growth, reproduction, and many homeostatic functions. Question 89. A medical assistant is providing dietary teaching to a patient diagnosed with hypertension. Which of the following modifications should the assistant recommend? Option A, increase sodium intake. Option B, reduce sodium intake and follow the DASH diet. Option C, eliminate all carbohydrates. Option D, high protein, high fat diet. The correct answer is option B. Reduce sodium intake and follow the DASH diet. Hypertension teaching emphasizes reducing sodium and following the DASH eating pattern because both help lower blood pressure and cardiovascular risk. Increasing sodium raises blood pressure, while extreme carbohydrate elimination or high-fat dieting is not the standard hypertension recommendation. More sodium promotes fluid retention and can raise blood pressure, which works against hypertension management. Removing all carbohydrates is not a standard hypertension recommendation. Blood pressure teaching emphasizes sodium control, balanced nutrition, and heart-healthy eating patterns, and a high-fat diet does not align with DASH-style counseling and may increase cardiovascular risk in a patient already being treated for hypertension. Question 90. Which of the following types of codes are used to classify alphanumeric descriptions of procedures and services performed by providers? Option A, ICD-10-CM. Option B, CPT. Option C, DSM-5. Option D, E/M.
The correct answer is option B, submitting an underfilled light blue coagulation tube.
CPT codes describe medical, surgical, and diagnostic procedures and services performed by providers. ICD-10-CM codes describe diagnoses, and DSM-5 is used for mental health diagnostic classification. This code set is used for a different coding purpose, such as diagnoses, supplies, procedure details, or evaluation and management levels. Question 91. Which of the following conditions is an inflammation of the lining of the stomach and intestines, often caused by a virus or bacteria? Option A, gastritis. Option B, gastroenteritis. Option C, colitis. Option D, diverticulitis. The correct answer is option B. Gastroenteritis. Gastroenteritis is inflammation of both the stomach and intestines and commonly causes nausea, vomiting, diarrhea, and cramping. Gastritis is limited to the stomach, while colitis affects the colon. Diverticulitis is inflammation or infection of diverticula, usually in the colon wall. Question 92. A medical assistant is collecting a sputum specimen from a patient. When is the best time for the patient to collect this specimen? Option A, immediately before bedtime. Option B, first thing in the morning before eating or drinking. Option C, 2 hours after eating lunch. Option D, anytime throughout the day when coughing increases. The correct answer is option B. First thing in the morning before eating or drinking. Early morning sputum is preferred because secretions accumulate overnight and the patient has not yet diluted or contaminated the specimen with food or drink. Random daytime or bedtime collections are less likely to produce an optimal lower respiratory specimen. Bedtime collection is less useful for sputum because secretions accumulate overnight and are best collected after waking. Food and oral debris can contaminate the sample, making post-meal sputum less ideal, and random timing may produce a less concentrated or less diagnostic sample than the early morning specimen. Question 93. Which of the following precautions must a medical assistant take when handling a patient with active varicella, chickenpox? Option A, contact precautions only. Option B, droplet precautions only. Option C, airborne and contact precautions. Option D, standard precautions only. The correct answer is option C, airborne and contact precautions. Varicella requires airborne and contact precautions because it spreads through airborne particles and direct contact with lesions. Standard or droplet precautions alone are not enough. Varicella spreads by airborne particles as well as contact with lesions, so contact precautions alone are incomplete. This action does not address the highest priority safety or procedure requirement in the STEM, and standard precautions are used for all patients but are not enough for active varicella. Question 94. Which of the following terms describes the maximum amount of money an insurance plan will pay for a covered healthcare service in a given year? Option A, lifetime maximum. Option B, allowed amount. Option C, out-of-pocket maximum. Option D, capitation.
The correct answer is option B, a sharp, radiating, electric-like pain down the arm.
A lifetime or annual maximum is the cap an insurance plan will pay for covered benefits during the stated period. An allowed amount is the approved payment for a single service. Out-of-pocket maximums limit what the patient pays, and capitation is a payment arrangement with providers. Question 95. A patient presents with a blood pressure reading of 142/92 mmHg. Which of the following categories does this blood pressure level fall under? Option A, normal. Option B, elevated. Option C, stage 1 hypertension. Option D, stage 2 hypertension. The correct answer is option D, stage 2 hypertension. A blood pressure of 142/92 mmHg falls into stage 2 hypertension because the systolic value is at least 140 or the diastolic value is at least 90. Elevated and stage 1 categories are lower ranges. Normal blood pressure is below 120/80 mmHg, elevated blood pressure has systolic 120/129 with diastolic below 80. And stage 1 hypertension is lower than 140/90 under current adult categories. Question 96. A medical assistant is preparing to assist with a sterile surgical procedure. Which of the following is the correct order for performing a surgical hand scrub? Option A, wash hands, apply sterile gloves, rinse arms. Option B, clean under nails, scrub fingers, hands, and forearms up to the elbows with an antimicrobial agent, rinse keeping hands elevated. Option C, wash hands with bar soap, dry with a paper towel, apply alcohol gel. Option D, put on a sterile gown, then scrub hands with water. The correct answer is option B. Clean under nails, scrub fingers, hands, and forearms up to the elbows with an antimicrobial agent, rinse keeping hands elevated. A surgical hand scrub begins with cleaning under the nails and then scrubbing the fingers, hands, and forearms with an antimicrobial agent. The hands are kept elevated while rinsing so water flows from clean fingertips toward the elbows. Gowning and gloving occur only after the scrub is completed. Question 97. Which of the following values represents a normal adult pulse rate reference range? Option A, 40 to 50 beats per minute. Option B, 60 to 100 beats per minute. Option C, 110 to 130 beats per minute. Option D, 140 to 160 beats per minute. The correct answer is option B, 60 to 100 beats per minute. A normal resting adult pulse is typically 60 to 100 beats per minute. Rates below or above that range may indicate bradycardia or tachycardia depending on context. That rate range is outside the typical adult resting pulse range unless a special condition is present. Question 98. Which of the following terms describes the process of converting a medication from its original form into an inactivated state that can be eliminated by the body? Option A, absorption. Option B, distribution. Option C, metabolism. Option D, excretion.
The correct answer is option A, blood splashing into a phlebotomist's eyes.
Metabolism converts medications into inactive or more water-soluble forms for elimination, primarily in the liver. Absorption, distribution, and excretion are separate pharmacokinetic steps. Absorption is a different medical term, so its meaning does not fit the definition given in the STEM. Distribution is a different medical term, so its meaning does not fit the definition given in the STEM, and excretion is a different medical term, so its meaning does not fit the definition given in the STEM. Question 99. Which of the following microcollections tubes should a medical assistant draw first when performing a capillary puncture? Option A, lavender top, EDTA. Option B, green top, heparin. Option C, red top, serum. Option D, gray top, sodium fluoride. The correct answer is option A, lavender top, EDTA. For capillary collections, EDTA specimens are collected first to reduce platelet clumping and preserve hematology results. Serum and other additive tubes follow according to capillary order of draw. Green heparin tubes are not first in capillary order when EDTA is needed, serum tubes are collected later in capillary order, and gray fluoride tubes are generally collected after EDTA and other additive needs. Question 100. A medical assistant is performing a venipuncture. Which of the following tubes should be inverted 8 to 10 times immediately after collection to mix the additive? Option A, plain red top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, glass serum separator tube. The correct answer is option B, lavender top tube. Lavender EDTA tubes are inverted 8 to 10 times to mix anticoagulant and prevent clotting. Blue citrate tubes are typically inverted fewer times, and plain serum tubes do not contain anticoagulant. Plain red tubes do not contain the EDTA additive that requires repeated mixing for hematology specimens. Light blue tubes contain sodium citrate and are used for coagulation studies. They are not the tube for CBCs or many chemistry tests, and serum separator tubes are mixed fewer times and allowed to clot. Vigorous or excessive inversion can damage cells.